Hey everybody, I'm Reverend Audra Apt at Abundant Life Ministries, and today I want to introduce you to two new interns that we have working with us this winter and spring. They're from UNCG Program of Public Health, and they're both seniors in the undergraduate program. Their names are Hina, Braddy, and Jordi, Perez, and we're so excited to have them working with us this spring, and I want you to get the chance to get to know them today. So the first thing I'd love for you both to share with us is where are you from and where does your family live right now?
Hi, so I am from Elizabeth City, North Carolina, and my parents are also from Elizabeth City, North Carolina, and which is about 3.5 to about 4 hours away from Greensboro. So I'm quite a drive away from home.
And I'm from Ocracoke, North Carolina. It's kind of like on the coast of North Carolina, but and my parents also live there. We've probably lived there for like actually my whole life, but yeah, it's pretty far from Greensboro. I mean, you have to take a ferry to get on the island on and off, but other than that, yeah.
Thank you, Hina. Thank you, Jordi. At Abundant Life, as you all know, we really care about our community's health and the healing that we all need and that we know God intends and wants for each and every one of us in our community. I have asked Hina and Jordi to tell us a little bit about what they'll be focusing on for their internship this spring.
So this spring for the internship, I will be working with you guys to find and provide information about grief and loss surrounding COVID and life in general. I will also be working with you guys to figure out your community needs. So if you need anything, please do not hesitate to tell me.
So basically, to follow up with what Hina said, we are going to be helping out with just people who've endured grief and loss in their community. It is something that's definitely been affecting everybody now with COVID going on. But exactly what she said, we are here to like serve, to help. We're here to gather information, to research, to get to know more about like if we can expand this as well. But yeah, that's pretty much it. Yeah.
Thank you. It's such an important theme and part of our lives that we don't often think about as part of public health. And that's why we're so excited that both of you, Hina and Jordi, are here among us to help us think about this more and learn more. I would love to know from both of you, what got you interested in public health?
So at first I was a biology major on a pre-med track, but I realized after taking biology and chemistry classes that I was not equipped to be a doctor. So I took a global health class instead, which was a public health elective. And I realized in that class, I loved the information, the way that it was taught, the scope of which it was being taught in. And so I was like, okay, so maybe public health is the major that I want to go into. And yeah, that is why I chose public health as my major.
So basically, I was also a biology major, and it just didn't work out. It was too much science. Even though I like science, it was a little too a little difficult for me. So I actually got into the intro to public health class by a friend of mine kind of told me the class was pretty good. So I kind of tried it out, and I like the whole kind of the idea of helping out in the community, just not through like medical needs, but actually looking through and trying to figure out what this community needs. And that's kind of what got me into this major, and it's been nice so far.
That is fantastic. Thank you to the both of you for following those nudges when one thing didn't seem to be working out, to look around and see where your passion was leading you. We're excited. We're excited for the both of you and excited that you're with us. And my final question for each of us today, in fact, is when you're having a bad day or a hard day, what is one thing that makes you smile or makes things a little easier for you?
So on a hard day, one thing that I really like to do is take a nap. I think that taking a nap kind of resets me as a person, so that it's like waking up fresh, waking up new, waking up able to take on these obstacles that I probably was not able to take on earlier in the day. I know that these obstacles are still going to be in the way, but I at least have a fresh mind to take it on.
And I guess music definitely helps, definitely makes me feel better. It's always like a genre to listen to that it can always brighten your day up, or help you figure out what you need for the day, or just, I don't know. Yeah, music just helps out a lot.
Both of those are so true. And for me, I try to call a friend, just to hear somebody else's voice, get distracted from whatever like I've been stewing in, and just get a perspective from somebody I know loves me, and I know I love them. It's often really helpful for me. So everyone, I am so excited to introduce you to Hina and Jordi. They're going to be with us this spring. You may get to meet them, or you may receive a call from them. We never know what this pandemic is going to bring with us, but we are going to be working together to learn and to grow as a community and see how we can stand with each other, especially in the grief and the loss that is affecting so many of us during this time. God bless you all. We love you. Stay safe. And we'll talk to you real soon.